Okay, hi, Dr. Andy Young with Carrie, a registered dietitian over at St. John's. And we just wanted to go over one of the toughest things for our patients dealing with arthritis. These are patients who have pain, they can't move very well, and they've put on weight. And that weight just makes everything harder. So, what is the role of a nutritionist in dealing with weight gain and arthritis?
So I think the role of a nutritionist, dietitian is to sort of be like a coach, be an accountability partner, be an educator. We wear many hats throughout the whole process, but really it's to help guide a patient and sort of what's going to help, what strategies can they take to help improve their health, lose a little bit of weight, start feeling better.
So what commonly happens is somebody will come in 30, 40 pounds overweight, and they've been in pretty good shape. They've been athletic the whole life, but they can't walk. They put on an extra 20 pounds, and they say they've tried everything. And they're thinking, there's nothing that works. I'm just this way. What does working with a registered dietitian look like then?
I think with that, it's sort of, there's always little things that we do every day that might kind of add up to that extra 5 pounds. And then any 5 pounds you gain, like around the holidays, usually you don't lose it again, you hold on to it. And so it's sort of helping a dietitian can work with you to kind of figure out what are those little areas in your life that might be causing you to gain 5 pounds, gain 10 pounds. And so we help to kind of break it all down, simplify it, take a look at, your daily eating habits, your lifestyle, barriers, and we sort of take that whole picture and sort of try to pinpoint what maybe do we need to adjust to a change to help get you to where you want to be.
What do you mean by barriers to food? What are those?
So barriers tend to be things like I don't have enough time, my work schedule's too busy, I don't like cooking, I don't know how to cook, I don't like exercising, or those generally tend to be the kind. There's all kinds of barriers. Stress, all of those things can impact whether we're able to make a healthy food choice or not, even financially. What if you don't have enough money to go get those healthy groceries? So those are all kinds of the types of barriers we might see.
And then how do you analyze what a person eats?
Generally, the best way is to do like what we call a food recall or a food diary. So kind of talking through the person, saying, what have you eaten over the last 24 hours? Or, before they come to see us, will you keep a 3-day food log so we can go over it when you come, maximize our time together? And so that's kind of the best way to sort of get a feel for what a person's eating.
Yeah, and that's so important to hold yourself accountable because people forget what they eat. They remember the big meals, but they forget all the little snacks they've had throughout the day.
Definitely, yeah.
And that's where all the benefit can come from, identifying those small opportunities where you can make different choices.
Because it's usually not like a big change that someone needs to make. It's more small little things. Like they didn't realize they were eating such a large portion of pasta with their meal, or they thought nuts are healthy, I can eat as many nuts as I want. But at the end of the day, nuts have a lot of calories in them, and so if you're eating half a jar of nuts, the portion size is only a handful. So we need to kind of make those adjustments that could lead to a big difference.
So it's coaching.
Coaching, pretty much, yeah.
So then once a person comes in and then they're looking at, I gotta drop 20, 30, 40 pounds, how do you start them on that plan? So they've done the food diary, you've gone through the barriers, but then now they're facing the overwhelming task of trying to drop 40 pounds when they've tried everything.
So I think the biggest thing is that, Rome wasn't built in a day kind of thing, right? So if you're focusing on a 20-pound weight loss, that sounds really overwhelming. But if we break it down into segments, saying our goal this month is to go down 5 pounds, to go down 6 pounds, breaking it down into smaller, more manageable things, working with the patient or the client to say, what is feasible to you? What changes are you willing to make? I think it makes it more manageable and also more doable, because really we want to feel motivated, encouraged to make these changes, to make them sustainable. So it's really breaking it down into smaller pieces so that we can get to the ultimate goal.
And so following these programs, so if a person does come in, what is a realistic amount of weight loss? Is there a range that you would say, wow, that's great, or this is what's typical, or sometimes it doesn't work?
Yeah, certainly there's a lot of like fad diets out there that you can lose a lot of weight really quickly, but I always think about how sustainable is that? Can you do this long term? And the overwhelming answer often is no, I can't. I could never do this for the rest of my life. So a a realistic and sustainable, which is like the biggest thing, sustainable would be probably about 1 to 2 pounds a week. Just, the research, the evidence shows us that when you lose that amount of weight weekly, you tend to keep it off in the long term. And that's what we're looking for, is long-term success.
So you're thinking anywhere between 5 to 10 pounds a month?
Mm-hmm, yeah.
And then what do you typically see, the highly motivated patient, what percentage is that? Is that like 5% or 10% or 20% will get that 10-pound weight loss?
I think it'd probably about 20% of the population.
Okay, and what about the rest of us? They're just,
I would say
we're not superstars, we're just following directions.
Probably in a month, 5 pounds.
5 pounds.
Yeah, and it would depend like how active you were or how much you were able to exercise, because all of those would impact it as well.
So over 3 months, that's 15 pounds, which is a sizable amount of weight.
I mean, that's at least for most people, that could be about 5 to 7% of your body weight. And in terms of looking just solely at diabetes risk, for someone who's pre-diabetic, if they lose 5 to 7% of their weight, they could potentially get themselves out of that pre-diabetic category.
Get themselves off meds with better control of blood pressure, sugar.
Yep.
Yeah. And then what are the actual strategies? There's so many diets we hear about: paleo, Atkins, Jenny Craig, Weight Watchers, Mediterranean. How is a person supposed to make good food choices with all this stuff out there?
I think it's really looking at what's going to work for you. If you don't like broccoli, I'm not going to tell you to eat broccoli, but we need to find a better substitution, something you do like. Paleo is a great option. I think it doesn't eliminate a ton of food groups, but some of them, looking at, do you think you could stick for it for the rest of your life? And I think that's the question to ask about any of these diets that are out there, is can you do this for the rest of your life? Out of all of them, I think, and it's been rated as the #1 diet, is the Mediterranean diet. And it really focuses a lot on the plant-based. So are we making sure that each meal we're getting vegetables, that we're getting non-processed carbs, that we're getting protein? And those are really the highlights of those that have the most longevity, the best health, is really they make it a point at every meal, I'm going to have some non-starchy vegetables like broccoli or kale or carrots or bell pepper. And then I fill in with a moderate amount of carbs and a moderate amount of protein. And that's really going to give you the right combination of fiber, of micronutrients, of macronutrients. That's really going to keep you satisfied and not make you feel like you're missing out on anything.
Which one do you follow?
I would say I'm a flexitarian. So I eat meat, definitely. I eat vegetarian, I eat vegan. So I try to just incorporate my biggest guiding principle in my food choices is really making sure that at lunch and dinner I always have a vegetable, because those have tons of nutrients in there. They help with brain health, they help with heart health, keep my blood sugars in good ranges, but they're also high in fiber and low in calories. So I feel full and satisfied, but I don't feel too heavy.
Do you take any supplements, any macro or micronutrient supplements?
I just take a multivitamin. Yep, that's about it.
Okay. I followed a lot of different ones as I tried to learn nutrition. I tried vegetarian for 4 years, and I just didn't find it very interesting.
Yeah.
And so I think I found that for me it's much more effective and sustainable to follow a high protein, low carb lifestyle. And these aren't really diets; these are just lifestyle choices.
Yeah, really. I mean, it's like, I think the term diet has a really negative connotation, and so for a lot of people, they think, oh, I have to follow a diet. This is the worst thing ever. So it's really making it work for you. I'm not one to say paleo is better than Atkins is better than, what's another keto. But I think the biggest thing is more so what's going to work for you. So if you want to just do paleo for dinner, fine, do paleo for dinner, but let's make sure you're getting the nutrients your body needs.
Okay, that's great. And then where can patients find St. John's Nutrition and Dietitian?
So we are located on the 4th floor of the Providence St. John's Hospital in the outpatient nutrition office. We also do classes. We're going to be doing a cooking class at some point, diabetes classes. So we're kind of all over the Santa Monica area.
Yeah, and weight loss isn't one of those topics that patients are very comfortable talking about. Patients seem to be very comfortable talking about muscle atrophy and weakness, working with a physical therapist as a coach, and that is certainly one part. But it's actually okay to get help when it comes to the nutrition side, and that's just as important. So physical therapy for training and a nutritionist for eating. And so that's a very important component of pre and post-surgical preparation. All right, thanks, Carrie.
Thank you.